everyone, happy new year. We made it to 2022. Yay. I hope we all are good. I am so grateful to all of you who has been supporting me, watching my videos, sharing my videos. I pray that this year 2022 is gonna be a beautiful year for all of us. Today, and it's all about preparing for your interviews and commonly asked interview questions and their answers. Okay, so before your interview, then make sure you've planned where you're gonna have your interview, because it's usually virtual interview now because of the outbreak of the coronavirus. So most of the employers are doing their interviews online, so you get a link for your interview via Teams or Skype. I never got anyone for Skype, it was all on Teams. Okay, so it all depends on what your employer prefers. So make sure you have a good internet. Make sure you have a good internet on your interview day. Okay, assess your environment before that day. Make sure it's cool and calm, you don't have any background noises. Make sure that your phone or your laptop or whatever device you're going to be using is working properly, so as to avoid any disconnection in the way. Okay, do you know that I almost lost my job? In fact, my current employer, was the day I had my interview, I had issues with my internet because I was outside the house and I was in the outskirts of our town. Okay, so there was no network coverage there. In fact, I would say that it's luck and grace and destiny that I am here today, because it's already destined that I will be here, because on that day I didn't have any good interview, any good network coverage, but I was lucky and the interview was rescheduled for another time. And by that time I made it back home and quickly got ready, and I had the interview, and I'm here. I'm currently with my employer, Catherine General Hospital, and I can say that it's been a nice time. I thank them so much for the patience of rescheduling the interview. It's not everyone that will get that favor, so it's a very big favor. So that's why I'm urging us to make sure that we have a very good internet on our interview day. Okay, because a lot of people have missed their interviews because their employer said we're going to reschedule you for another time, and they never got any other invitation, and that was how they lost the opportunity. So make sure you have a good internet background. Okay, also ensure that you've prepared some scenarios. Prepare yourself beforehand. Ask questions, okay, because there are a lot of people who have done this before you. Ask them how they were able to do their interviews and how they were able to answer the questions correctly. Okay, ask the right people. Okay, don't close your mouth. If you close your mouth, you will not get help, because nobody will know what you are going through until you ask questions. Okay, and also make sure that you've read about the hospital, you've studied about their values, their policies, if there is any new development. Okay, the job description, person specification. Make sure that you know what they want from you and you are ready for them. Okay, so on the interview day, on the D-Day, so you have to dress formally and sit upright and maintain a good eye contact with your interviewers. Okay, smile at them and see them as your friend. Don't see them as strangers. Okay, just feel free, relax and smile. Make it lively. Okay, make your interview lively. I know it's a formal invitation, but you need to also be lively. You need to engage them and make them smile. Okay, so I'll be going over to some of the commonly asked interview questions. They will usually first start by asking you to introduce yourself. They will ask you to tell them about yourself. Okay, so you tell them your name, tell them how old you are, if you're married, if you have a family, tell them when you went into school and when you've graduated, tell them when you got your first job, tell them that during the years of working, you've been able to work in maybe different hospitals and in different departments as well, and you've gathered a lot of experience. Okay, you've met quite a lot of professionals and they have shaped you. You have gotten a lot of experience in the process of working from one hospital to another. Okay, and that is why you are also looking forward to them to employing you, because you want to get more experience, because you know they have a high standard of care, their professionalism is quite high. Okay, so that is why you want to come over and work, and so that you can grow in your career, so that you can get to meet other people and okay, share your knowledge and learn. Okay, so that's where they ask you to introduce yourself. Okay, and after that they're going to ask you why you want to be employed by the NHS. Why do you want to work for the NHS? Okay, so tell them you want to work for the NHS because of the high values of the NHS. Okay, tell them because of their high standards of care, their professionalism, because of the continual learning and development, because you have browsed about them and you can see that they offer you some trainings, they are going to assist you to grow in your career. Okay, tell them because of the benefits that are attached to working with the NHS. Okay, like some of the benefits, like your job security. Okay, when you're working with the NHS, you are secure, your job is secured. Okay, so tell them all of those. Tell them because of the annual leave allowances. Tell them because of the sick off and all of those. Okay, that is why you want to work with the NHS. Okay, so that's it for why you want to work with the NHS. And they might start asking you some scenario based questions, and some of these questions are competency based. Okay, they want to ascertain your level of competence. They want to know how good you are with your nursing skills. Okay, so they're going to ask you few scenario questions, competency based questions. So I'm going to tell us how we can answer those questions. There is a technique called the STAR technique. STAR. S stands for situation, T stands for task, A stands for action, R stands for result. So competency-based questions are those questions that assess your competency level. So your interviewer might ask you that in the past you were administering your nursing duties and you learned that a patient has collapsed along the corridor. What did you do? Okay, they want to know your competency level. So that's, your mind should immediately go over to BLS, basic life saving skills. Okay, so you tell them that immediately you were informed of your patient that has slumped or has collapsed, that you immediately run to the scene and putting on the appropriate personal protective equipment. Very, very important. You assess the scene of the patient for safety, and you saw that the scene was safe for you to approach and there are no harmful objects around the patient, and then you call the patient to know if he will respond, and there was no response. Okay, you immediately called for help. You shouted out for help, and you assessed the airway of the patient. You did the head tilt, chin lift maneuver, and you assessed the airway for any obstruction, and there was no obstruction. The tongue was not occluding the airway. You also looked for the rise and fall of the chest. You listened for breath sounds, and you felt for gush of air. And after assessing your patient, there was no response from this patient. You immediately asked the help to call 2222 and tell them that there is an adult male or female cardiac arrest in Ward A, and that they should get the resuscitation trolley and an oxygen while coming. Okay, and then you started the cardiopulmonary resuscitation. Okay, that you started giving this patient chest compressions. You gave 30 chest compressions against 2 rescue breaths. Okay, until when the cardiac arrest team arrived, then you handed over to them and ensure that they've set up the defibrillator, and then they gave the cardiac shocks as directed, and then you documented everything. You handed over to them using SBAR. We know what SBAR is all about. Okay, so SBAR means situation, background, assessment, and recommendation. Okay, so you handed over to them using your SBAR, and then the patient was moved to the ITU for that care. You informed the charge nurse and you informed the medical team, and you washed your hands afterwards and discarded your personal protective equipment. So that is that you have been able to prove to them that you are competent enough in life-saving skills. Okay, so that is an example of a competency-based question. Okay, so this scenario I've just responded to is an in-hospital resuscitation. There is also community scenarios where you were asked on your way back from work. You met a patient, you met someone who collapsed by the road. What will you do? So you know at that point there might be bystanders, people who have crowded around the person who has collapsed. So you try to introduce yourself to the crowd and tell them to stay away from him so that they can get enough air, and then you instructed them to call 999 and tell them that there is an emergency in that area, and then you assess the area. There is no any harmful object for this patient, and the patient is not responding to call or touch, that you started your cardiac compressions. Okay, and because it's on the way, you weren't prepared, it's an emergency that you weren't prepared for, you only kept the chest compressions until the emergency team arrived and you handed over to them. Okay, so that's it about a time you were able to resuscitate a patient who has collapsed, probably due to cardiac arrest. Okay, so that's that one. They might also ask you to tell them what you will do if your patient whom you've given insulin has just started sweating and is telling you that he's feeling dizzy and fainty. What are you going to do? So you will tell them that you will immediately cross-check the blood glucose level, and if it is below 4 millimole per liter, because anything below 4 millimole per liter is hypoglycemia, and anything above 7 millimole is hyperglycemia. So it should be between 4 to 7 millimole per liter. So if it is below 4, then it's hypoglycemic attack and you need to immediately act. Okay, so if patient is conscious and is able to swallow and eat, then you can give the patient a glucose tablet to swallow, and also or glucogel or a glucose drink and orange juice. You can give that to the patient at that time and check the blood sugar level again within 15 minutes. Okay, and if it has come up a bit above 4 millimole per liter, then you're going to give the patient a carbohydrate containing meal that will sustain the patient. Okay, and you will inform your charge nurse, you inform the doctor, you will document what has happened, and you will keep on monitoring the patient closely. But if it's an unconscious patient, or patient has had the hypoglycemic attack and he's unable to talk, he's unable to swallow, then you can't give the glucose tablet. You have to administer 10% glucose, okay, intravenously, or you can administer prescribed intramuscular glucagon injections. Okay, and then you monitor closely every 15 minutes, blood sugar, vital signs, inform the doctor, document your findings. Okay, so that's that for managing hypoglycemia. So all of these examples I've created are competency based questions. They are ascertaining your level of competence, okay, what you can do if you are faced with such challenges. Okay, so they might also ask you another one. They will ask you that can you tell them what you would do if you find two of your colleagues who are exchanging words, who are quarreling, what are you going to do? So that's this type of question is a behavioral question. They want to know how you will respond to a misunderstanding between your colleagues. So at that time, you will have to intervene, okay, and take them apart and take them away, okay, and do not try to judge anyone. You try to hear both parties what is happening, okay, and then you have to inform your charge nurse. You have to inform the ward manager or the charge nurse, okay, and make sure that the situation is de-escalated at that time, okay, so that you're not going to be in favor of anyone. You will just have to report to the charge nurse and intervene in the matter immediately, okay. So that's it. And they might also ask you, if you have a patient who has developed bed sore, what are you going to do to prevent further bed sore, or what are your role or responsibility in prevention of bed sores? So tell them that you will inform the medical team if the patient has developed bed sore, and you will assess the patient properly, assess the other pressure areas that might be predisposed to bed sore, okay, and you make sure that the patient is turned regularly if it's an unconscious patient, and at least 2 hourly turning. If it's a conscious patient, you encourage him or her to change his or her position from time to time, okay, and that you're going to use the right bed and mattress to nurse the patient. And you will also inform the dietitian who will come to assess this patient, and they prescribe a nice diet that will promote quick wound healing. You will also make sure that prescribed medications, especially antibiotics, are administered, okay, in order to promote the healing of the wound. You document and you will keep on monitoring your patient closely. So that is your response for that question, okay. So it's as simple as that. All right, so because of the pandemic, because of the coronavirus, infection control is now the priority for every hospital. So it's likely they will ask you how you will promote infection control if they employ you, okay. So you will tell them that you're going to adhere to the hospital policy, okay, for infection control, and you're going to make sure that you dispose of wastes appropriately, use according to the codes, the color codes, okay, of waste disposal. Tell them that you will wash your hand properly according to the WHO standard. Do we know how to perform hand washing? Okay, we need to learn how to do that if we do not know how to perform it. It's quite simple. I'm going to run it down. It's palm to palm. After wetting your hand with water and soap or with hand sanitizer, so you go palm to palm, back of the palm and vice versa, fingers interlaced, fingers interlocked and vice versa, tip of your fingers in a rotational manner and vice versa, thumbs in a rotational manner and vice versa, your wrists and vice versa. You raise your hands, draw your hands, and your hands are clean. So that is the WHO standard for hand washing, so that you are going to put up the appropriate personal protective equipment, and you're going to maintain aseptic non-touch techniques, okay, and you make sure that patients who require isolation are properly isolated, okay, and staff who are sick are not allowed to care for the patients. So those are measures you are going to put in place to ensure that infection control of the hospital is maintained. Okay, so they might also ask you how you are going to manage a confused patient, an elderly patient who is confused. How are you going to manage him or her? So tell them that you're going to nurse this patient in a well-lit environment, and you have to introduce yourself from time to time to familiarize yourself with the patient, because a confused patient can easily forget you, and when you come to attend to them, they might become aggressive or scared or nervous. So you introduce yourself from time to time, each time you come in contact with your patient, okay. Tell them that you make sure that everything the patient needs is within easy reach, so that the patient does not try to go a far distance to fetch what he needs, and he will sustain a fall, and that will be bad. Okay, so you tell them that you make sure that familiar things of the patients are kept for them so as to remind them to keep their memories fresh. Okay, so their favorite pillows, their favorite dresses, okay, are always available around the patient's corner. Okay, so that the patient can be able to keep the memories fresh. Okay, tell them that you're going to nurse the patient close within close reach, so that you can monitor him or her frequently and know when the patient is about to wander. Okay, so you also tell them that you are not going to nurse this patient with the bed rails, because a confused patient who has a bed rail up will think you are trying to restrict him with the bed rail, and he will try to climb over the bed rail and sustain a fall, and that type of fall from that height is not a small fall. So tell them that you will not nurse this patient with bed rails, that you will have to monitor the patient closely just to make sure that the patient does not sustain any fall. Okay, so that is that one. They might also tell you about your workplace. What does your employers or your colleagues think about you in your current workplace? Okay, tell them that they think you are a hardworking person, they think you are a jovial person because of how you relate with them, they think you are a dedicated nurse, okay, because you don't joke with your duty, you are always punctual. Okay, tell them that they think you are an easygoing person. Okay, so just tell them positive things about yourself, and they will ask you about your role. What are your role as a nurse? So you tell them your roles, your communication skills, your leadership skills, your managerial roles. Okay, evidence-based care role, and medication administration, assessment planning, implementation and evaluation of patient care. All of those are to be included. Okay, so I'm going to stop here for now, and I'm going to come again with another section of the interview, because there are quite a lot of interview questions that I've come across. Okay, I hope this helps you in your interview preparation, and I wish you the best of luck. Okay, all right, bye. Do not forget to subscribe, like, and share. Okay.